Hi, my name is Dr. Daniel Stewart. I'm a doctor of physical therapy practicing in Salt Lake City, Utah. After hundreds of tests and over a year using the Activforce 2 device, I wanted to take a moment to share with you some of the best practices that I've learned in order to help you get the most out of your Activforce 2 device. The key to getting an accurate strength measurement is by making sure the device doesn't move while you're performing the strength test. The most important way to do this is making sure that you have more leverage than the muscle that you are testing. So one of the key things I do is I make sure that I have enough room to get my elbows fully extended so that there's more leverage in my body than that muscle. Sometimes that includes having to get on a step or a stool to be higher than the patient. Another way to get leverage is by using the belt loop and the belt plate and tying it to a stationary object. And another example is, let's say you wanted to use a wall. You could tie using the hand strap. You could place the device on a certain body part and have them place against the wall and push against the wall, and that would give you a very accurate measurement with the device. And another best practice is when you're testing range of motion is you want to get the device as distal as possible from the joint you're testing. However, you do not want to go over a second joint because that can bend at an angle that will skew your measurement. For example, when you're measuring shoulder flexion, if I lift my arm and I have the device pegged at my wrist and I bend my elbow, it's going to measure 180 degrees of shoulder flexion when really I'm only getting about 140. So by attaching the device at the distal end of my humerus, I can lift my arm all the way up and get a more accurate measurement. The same is true across the body. Remember, distal is always better as long as you're not crossing two joints. Another best practice when measuring range of motion with the Activforce 2 device is making sure that it stays in the same plane. For example, the device is programmed to measure range of motion in the sagittal plane, in the frontal plane, and the transverse plane. So when you're testing, make sure that it stays in the same plane, because if you allow it to cross 2 or 3 different planes, it'll add inaccuracies to your measurement. One thing that has really helped me in my practice with my patients is by comparing one side to the other. Now, sometimes you may not get the exact same measurement you were expecting based on goniometer or manual muscle testings with the hand, but if you're comparing it and you do it the same way to the other side, you are going to get an accurate comparison to the two sides. You can also, if you do it the same way in subsequent tests, it increases the reliability of the device. Another important thing when you're testing strength and you want to get an accurate and reliable measurement is you want to remember what angle the joint is when you test it. For example, if you test the knee extension, right, the quad muscles at 90 degrees, you want to do it at the same joint angle as you did the last time, because we know that there's different strengths based on the length of the muscle. So always remember that if you're testing a joint one way, you should test that same way each time, or write a note that says, I tested this patient's knee at this angle. That way you're more reliable from test to test over time. One thing that's really helped me and my patients when I don't have a normative value for like a strength test is making sure that there's symmetry between the two limbs. So if I'm testing someone's knee strength and it comes out with a certain value, I'll compare it to the other side, and that will tell me if I need to work a little bit on the strength. One of the things I like most about this device is creating my own objective measurements. It allows for me as a clinician to think about the patient and what they do on a daily basis and try to create a dynamic objective measurement that is repeatable, and so that I can track progress over time using the device. I don't have to compare it against a goniometer or a strength test, but it allows me to better help my patients by tailoring their therapy towards them. Another best practice when calibrating the device for range of motion and strength tests is that you want to have the device and the strap placed lightly on the patient, but not pressing too hard, and holding it completely still until the device is fully calibrated. Once it's calibrated, the patient can then push into the device, or it can move with the device and get an accurate measurement. Another best practice is for patients or clients that don't have full elbow or knee extension. For these cases, I just use a goniometer to test full extension.